Nobody better exemplifies the commitment to saving lives from tobacco than Heran Gerba Borta, Director General of Ethiopia's Food and Drug Authority. Ms. Borta has fought vigorously for strong and effective tobacco control policies to protect Ethiopian citizens and the country's significant youth population. And we are honored to present her with the 2021 Judy Wilkenfeld Award for International Tobacco Control Excellence.
My name is Heran Gerba at Ethiopian Food and Drug Authority. I am the Director General for the authority. Ethiopia is the second most populated country in Africa. 70% of the population is a young population. When we compare to other countries, the number seems that prevalence of tobacco use is low, but because we are aspiring for prosperity, we have to have a very strong control on tobacco use. If we don't have the strong controlling mechanism, then this young population will be affected by the ill effects of tobacco use. We want our young population to live a healthy life and involve in the development agendas of our country and push our country to prosperity. So that's why the controlling tobacco use is very important to our country. We have banned fully electronic cigarettes, we have banned fully flavored tobacco products, and we have 70% pictorial health working on packaging. We have 100% smoke-free public places, government institutions, health institutions, because staying healthy, living healthy is a human right. And I know that tobacco control effort is a teamwork. So bringing that team spirit and bringing different organizations into one agenda has brought us into success of passing this very strong tobacco law. Hello to my fellow tobacco control champions in Ethiopia, throughout Africa, and around the world. I want to express my sincere gratitude to everyone who believes that my work and leadership on tobacco control are worth encouraging and recognizing. I received this award with great humility and respect. While serving in the Ethiopian Food and Drug Administration, the EFDA in short, for over a decade, I have come to believe in prevention as a best public health strategy. While my training and a significant part of my experience in earlier years were mostly related to pharmaceutical products and food safety, I came to realize the true ill effects of a weak tobacco control policy. I can think of no more impactful way to contribute to public health than to prove that tobacco control policy can in fact protect tens of millions of Ethiopians from addiction. Ethiopia is the second most populous country in Africa and has a unique demographics. These are a key factor that keep me doing my best. Ethiopia's population, now over 110 million, consists mostly of young people. More than 50 million are 18 or under. Without a doubt, Ethiopia's booming youth population and growing urbanization is the key business driver for the industry, and we must act now to prevent tobacco companies from targeting this use. The tobacco industry's publicly declared position to make the country a center of tobacco business made me fight even more fiercely in my role as head of the EFDA. The path towards Ethiopia's strong legislation was not easy. When the law was at a very draft stage, the federal government actually owned the tobacco industry. Even after the industry was privatized in the year 2016, enduring relationships between the industry and the highest levels of government complicated the entire process. However, this challenge gave the EFDA staff and me the strength to be even more strategic and never give up the fight. Our success would not have been possible without forging a strong relationship with civil society. I wouldn't be exaggerating to say civil society groups were the engine of our defense against strong industry interference until the law was passed in the year 2019. These groups, with support from the Campaign for Tobacco-Free Kids, supported the advocacy efforts through legal analysis and drafting, education, media advocacy, and countering the industry. Taking this opportunity, I would like to thank all my staff and the government officials who helped to create the successful collaboration with civil society partners. In particular, the leadership and commitment of the former Director General of the EFDA, the former Minister of Health, and the current Health Minister were critical. Now, I would like to assure you that I am committed to working harder than ever in my current role. Our next frontier is ensuring meaningful implementation of key tobacco control measures, such as the law's smoke-free provisions. Finally, I would like to thank the Wilkenfeld's family for this award, which is not only a recognition for Ethiopia's promising path, but a huge responsibility to me personally and the entire EFDA and Ministry of Health team involved in tobacco control. I want really to thank you very much. Thank you.